Use of the distractor on the pelvis. Instruments. The necessary instruments for this application are the large distractor with screw insertion sleeves of various lengths, a long 3.2 millimeter drill bit, 5 millimeter Schantz screws 150 millimeters long, 2 drill sleeves with accompanying trocars, and a universal chuck with T-handle. Acetabular fracture, ilioinguinal approach. Presentation of the model demonstrating the view of the surgeon in the case of an ilioinguinal approach. The fractures in the right hemipelvis are marked. The distractor is used as a help for reduction. Through a small incision, the anterior superior iliac spine of the opposite side is exposed and a hole at least 5 centimeters deep is drilled with a 3.2 millimeter drill bit. Insertion of the Schantz screw in the ilium. While avoiding the femoral vessels, the 5 millimeter drill sleeve with trocar is inserted percutaneously in the intertrochanteric plane. Removal of the trocar while retaining the drill sleeve and drilling with the 3.2 millimeter drill bit. Insertion of a 5 millimeter Schantz screw through the outer drill sleeve. Now the distractor is put onto the Schantz screws. A short screw insertion sleeve is used on the spina iliaca anterior superior, a long sleeve for the intertrochanteric plane. The distractor is placed so that the operator is not hindered. All the complete nuts and wing screws must be tightened, first by hand, and then with the combination wrench before distraction is begun. Pelvic ring lesion, ilioinguinal approach. While the reduction of a disrupted pubic symphysis is simple to accomplish with appropriate reduction forceps, the instrumental reduction of a pubic root is more difficult. With the distractor, the fracture can be held in reduced position during contouring and application of the pelvic reconstruction plate. Next, pre-drilling with the 3.2 millimeter drill bit. Afterwards, 2 Schantz screws are inserted in the spinae iliacae anterioris superioris and are connected with the distractor. Screw insertion sleeves of identical length are used. Tightening of the complete distractor joint, first by hand, and then with the combination wrench. The fracture is reduced and is placed under compression with the locking nut. Acetabular fracture, Coker-Langenbeck approach. View of the column as it would be presented for entry by Coker-Langenbeck. The distractor is used for the distraction of the joint, for the control of fracture reduction, or for the removal of free joint bodies. After drilling a 3.2 millimeter supraacetabular hole Insertion of the shunt screw. Another shunt screw is placed subtrochanterically, approximately parallel to the first one. Placement of the distractor so that the operator is not hindered. And fixation of the complete distractor joints by tightening the various nuts and wing screws. Distraction of the joint. Fracture of the sacrum. Dorsal approach. The distractor serves as well for the distraction, debridement, and longitudinal reduction of the sacrum. In the region of the spinae iliaci posterioris superioris, 5 mm shunt screws are inserted through 3.2 mm drill holes on both sides, so that they lie as parallel to one another as possible. Placement of the distractor using screw insertion sleeves of identical length. Fixation of the complete distraction joint through the tightening of the various nuts and wing screws. Distraction. And reduction of the fracture. The definitive reduction takes place with appropriate reduction forceps.